LMNAs Healthcare. LMNAs helps you to bring in scalability to the ever-growing field of medicine, patients and technology. Sprint ahead with our enterprise solution for healthcare that enables you to maintain all critical data under single roof. Introduction. LMNAs Healthcare helps you manage your hospital, clinic, or practice efficiently by scheduling appointments, capturing vitals, and managing medication and investigation orders by recording patient encounters. You can easily pull out a patient's medical history anytime to review the patient's past conditions and treatments, assisting you in providing effective, high-quality care. LMNAs Healthcare allows you to manage multiple medical code standards like the ICD-10 and easily search for medical codes, simplifying the coding process. LMNAs Healthcare also comes with a laboratory module with predefined templates for recording common lab tests. Reports like appointment analytics and lab test report help you get a thorough idea. Masters. Patient. In LMNAs Healthcare, the patient document corresponds to any individual who is the recipient of the healthcare services you provide. For every document, it is important to have a patient associated with it. Healthcare practitioner. Healthcare practitioners are the doctors, nurses, ward boys, lab technicians, etc. who are serving the hospital unit in one way or another. LMNAs Healthcare allows you to create multiple practitioners and link to a user with appropriate roles. You can also link a healthcare practitioner to an employer to track payroll, attendance, or other human resource management activities. Medical code standard. Medical coding is required in many countries for regulatory compliance, and many of the medical insurance companies manage eligibility and coverage based on medical code standards. LMNAs Healthcare helps encode diagnosis and assessments recorded as part of patient encounters. Healthcare Service Unit. LMNAs Healthcare helps you map your facility infrastructure and manage appointment scheduling, billing, etc. by creating healthcare service units. These are made available for appointment booking or inpatient occupancy, and also for billing. Laboratory. Lab test. Lab test allows recording multiple laboratory test details including organism, sensitivity, etc. LMNAs Healthcare allows you to manage a clinical laboratory efficiently by allowing you to enter lab tests and print or email test results, manage samples collected, create invoices, etc. Sample collection. It's critical for a laboratory to manage collected samples and print labels for those samples, automate sample collection, etc. Consultation. Patient appointment. LMNAs Healthcare allows you to book patient appointments for any date and alert patients via email or SMS. You can easily organize appointments for each practitioner based on their availability schedules. Patient encounter. LMNAs Healthcare allows you to record every encounter with patients through the patient encounter document. You can also create a patient encounter based on a previously booked appointment. Vital signs. LMNAs Healthcare helps you to capture the vital signs of patients at any point in the treatment process. All vitals information over time can be viewed as part of the patient history. Patient history. Maintenance of accurate and complete medical records of patients is one of the rudiments for healthcare practitioners and providers. Appointment analytics. Appointment analytics report helps you get insights about the number of appointments created according to medical departments. Healthcare practitioners. Clinical procedure. LMNAs helps you create and map clinical procedures for patients like wound cleaning or a cataract surgery. The system allows you to pre-configure clinical procedure templates, so that you do not have to set the default properties like the consumables, rates, items every time you conduct a clinical procedure. Inpatient record. LMNAs Healthcare captures all details about a patient admission using this document. Settings. Healthcare settings. Most of the global settings for the healthcare module can be done via the healthcare settings page. Medical department. To organize your clinic or healthcare units into departments, you can create multiple medical departments. Appointment type. You can create masters for various types of appointments. Appointment type allows you to predefine the duration of the appointment, specify whether it's inpatient, and set colors to differentiate between different appointment types for analysis. Prescription dosage and duration. You can configure different dosages to be used while prescribing medication to patients in the prescription dosage master. You can also configure the duration for which the patient has to consume the dosages prescribed for the medication in the prescription duration master. Complaint and diagnosis. To ease the data entry while recording the encounter impression, LMNAs Healthcare allows you to save every complaint, diagnosis data you enter, from the patient encounter screen itself. This way, the database keeps building a list of all complaints and diagnosis you entered. Lab Test Template. Lab Test Template in LMNAs allows you to create all types of lab tests rapidly. You can pre-configure the events and result components for single, compound, descriptive, or group tests, so that you don't have to fill in redundant data every single time. Clinical Procedure Template. LMNAs Healthcare allows you to configure templates with the various properties of clinical procedures to ease the procedure creation process. Templates allow you to manage the billable item, rate, etc. for a particular procedure. The Consumables section lets you set the consumable stock items, default quantities, etc. so that these items will preloaded in the clinical procedures created based on the template. This allows the performing practitioner can easily input the consumed quantities or add additional items which in reality has been consumed as part of the procedure. Healthcare Service Unit Type. LMNAs Healthcare helps you map your facility infrastructure and manage appointment scheduling, billing, etc. by creating healthcare service units. Finally, we reached the last part of the video. Thank you for finding time out of your busy schedule to sit through this demonstration. This shows your unwavering commitment to our cause. We are most grateful. Have a great day.